Hey guys, hello and welcome to my YouTube channel. It's been quite a long time since I made a YouTube video, and actually what's happening is that I am preparing for my examinations, so that explains my absence from YouTube. Today was Sunday and I was not studying for the whole day, and to end the day in a positive note, I decided let's make a video. But the next thing was to decide on what topic should I make a video. Should I make it on USMLE? Should I make it on the resources? Should I make it on something else? But then something in my mind that I had these examination papers in my cupboard, and I decided let's make a reaction video on one of my internal medicine examination paper from my final year, which I recently gave just 2 months back. So in this video I'll be reacting and I'll be discussing with you like what was my internal medicine paper like, and how did I attempted it. Okay, so just to give a brief idea about the final year MBBS in India, we have four major subjects and some minor subjects, and these four major subjects are internal medicine, surgery, gynecology, obstetrics, which composes of single subject, and finally we have pediatrics. Among the minor subjects we have psychiatry, which is included in the internal medicine. We have dermatology, we have radiology and orthopedics, which are included in the surgery. So in this video, let's react or let's discuss on my final year internal medicine examination paper. This was a theory examination which you have to write down, and apart from a theory examination, each subject will have a practical examination in which you get the clinical cases and the patients, and you have to examine them, you have to take their history, come up with diagnosis and explain everything to your professor. So reacting on my final year examination, we had 3 hours and the maximum marks were 60, and we had two papers like this is the paper 1 and we have a similar paper which is the paper 2. So reacting to my paper 1, we had in total 1 2 3 4 5 and 6 questions. The 4 questions were long answer type, and the 2 questions they were short answer type, which were further divided into 2 parts. So question number 5 and question number 6, they had 2 parts each. So reacting to first question, it was discuss the etiopathogenesis, clinical feature and diagnosis of acute myocardial infarction. So acute myocardial infarction or acute coronary syndromes included the STEMI and non-STEMI. They are quite important and quite popular questions when we come in the final year. So it was absolute no-brainer that this question will come, and it came, and it was carrying approximately 10 marks. So it was carrying 10 marks. The second question was classify seizures. You know what are seizures: absence seizures, tonic-clonic seizure, grand mal epilepsy, petit mal epilepsy, focal seizure, localized seizure. These are all the classification of seizure. Discuss the diagnosis and management of status epilepticus. You know what is status epilepticus: when there is no break between the two seizures, or a seizure is lasting for more than 30 minutes, then it is called as status epilepticus, and we have to manage it. Like you have the step 1 of management, in which you give diazepam, lorazepam. Then we have the second stage in which we give phenobarbital. Then third stage in which we give valproic, and if the patient is not responding to these treatment, then we have to finally go and do the endotracheal intubation. So this was again carrying 10 marks. The third question was discuss the etiopathogenesis, diagnosis and management of bronchial asthma. So bronchial asthma is a seasonal, is a reversible obstructive lung disease in which your bronchi and bronchioles, they are hyperreactive to external allergen or something internal stimulus. It may be extrinsic asthma, it may be intrinsic asthma, it may be exercise induced asthma, and it may be drug induced asthma, which is the asthma due to that aspirin. It was again carrying 10 marks. It was from pulmonology section. And finally, fourth question, it was discuss the etiopathogenesis and evaluation of iron deficiency anemia. Again a simple question. So you know what are the causes of iron deficiency anemia, but before you have to explain how will you look up or you will diagnose anemia, and how will you go with the investigations of anemia, in which you have to calculate first of all MCV, divide it into microcytic, normocytic, macrocytic anemia. Then among the normocytic anemia you have to do reticulocyte count, via which you divide them into whether they are hemolytic anemias, whether they are non-hemolytic. Among the hemolytic, again you have extravascular hemolysis, intravascular hemolysis and stuff like that, and you make a whole chart, and that is all about the evaluation. Regarding the etiopathogenesis of iron deficiency anemia, it depends on the age group actually. Like if you are dealing with infants and children, the causes are different. If you are dealing with adult, the causes are different. In case of male, they are different in case of females. If you are talking about adults, then you know it's colorectal carcinoma until proven otherwise. Now, these were the 4 questions, each carrying 10, 10, 10, 10 marks. I did well. Actually, I had studied all these questions, all this stuff. And coming to the 5th question, it was actually divided into 2 parts. The first part was thalassemias. Again, it came from hemat portion. So what are thalassemias? You know, in these thalassemias, there is a decreased globin production. Depending upon which globin is decreased, you have alpha thalassemia, you have beta thalassemia. Now, what will be the clinical findings? You know, crew-cut appearance, you know, chipmunk faces, you know, hepatosplenomegaly. So these were the clinical findings, and the question was carrying 5 marks. So the next part of question number 5 was a short note on vitamin D. Now, vitamin D has its link with endocrinology, it has its link with biochemistry. So you have to include both and then come up with the answer. So regarding the vitamin D, firstly you will discuss about the metabolism of vitamin D, like how vitamin D is hydroxylated first in the liver, then in the kidneys, and come up as activated form of vitamin D, which is 125 dihydroxy vitamin D3 or 125 dihydroxy cholecalciferol. So then regarding the actions of vitamin D, like it increases the absorption of calcium and phosphate from the intestine, also from the bones. And then what happens if vitamin D is not there? You will get rickets if it is a case of child, and you will get osteomalacia if it is a case of adult. Now, last question was, now what about thalassemias and vitamin D? Yeah, I did well in thalassemias, I did well in vitamin D because I was knowing them. Discuss briefly, this is the question number 6, again carrying 2 parts actually. First part was discuss briefly about syncope. So you know, syncope is like transient loss of consciousness. There may be so many reasons, like decreased blood flow to the brain, decreased nutrients to the brain, like hypoglycemia induced syncope, etc. Was having so idea about syncope, not to the point like what are the causes, and I had to think like what are the causes, are there any cardiovascular causes, are there any endocrinological causes, respiratory causes, and stuff like that, and eventually came with the answer and write that. So it was so. Talking about the acute mountain sickness, it was the second part of question number 6. Acute mountain sickness, you know, when you go to higher altitudes, there is what is called as respiratory alkalosis and pH changes, and these pH changes, they will cause headaches and stuff like that, and also the respiratory alkalosis. And also there is one more thing, that is hypoxia, because the oxygen tension in the higher altitude, it's bit lower. So hypoxia plus respiratory alkalosis, this is the whole stuff in case of acute mountain sickness. And talking about its treatment, it is acetazolamide. You know from your second year maybe, acetazolamide is a carbonic anhydrase inhibitor. It inhibits the reabsorption of bicarbonate, and by inhibiting the reabsorption of bicarbonate, it will lead to bicarbonate urea and stuff like that. So this was my question paper on internal medicine. So if I happen to make another video, I'll definitely cover the second part of my internal medicine exam. And if you like this video, do comment to make another video on other subjects and also the second part of internal medicine. So thank you so much for watching this video, guys, and yeah, Making this video makes my day end in a positive note. Thank you so much. Keep supporting. We are about to reach 5,000 subscribers in a month. Bye bye.